the issue obviously for every government and for Punjab government was to respond to the immediate challenges. And so the effort was focused more on health infrastructure, provision of personal protection equipment, making sure that we have enough ventilators, hospital beds, etc., etc. But then we also realized that there'd be an economic cost to the crisis. Chief Minister essentially constituted a steering committee headed by a finance minister, which comprised of people from all walks of life. We had former president of Lahore Chamber, representative of Chamber, Dr. Lijima, former governor State Banks, few retired civil servants, members of departments concerned. So this committee worked on a plan to mitigate the effects of the whole pandemic, and it looked at the gaps in the social protection area as well as in the economic impact. So we worked out a broad framework in which we would look at the government's effort and how we should use our resources and focus on mitigating the impact. Social protection was the primary concern, and then making sure that economic side is managed, supply chains are not broken. Following that, we worked on, because the federal government, the different agencies and international development partners, everybody was reacting to the pandemic. We realized that there was a need for a framework in which all of this discussion could take place. There was a lot of cross discussion and consultation between various forms of stakeholders. By that, I mean various organizations in the federal government, various donors, talking to health, talking to PDMA, for example. So PND led that effort in which we again took up the work that the steering committee had done, and we sort of focused on post-COVID work. And we have developed a larger, broader framework which looks at how we will use the impact of COVID all over the economy. Micro and SME sector and informal workers are the worst hit in this crisis. The most important element at this moment, or the ingredient at this moment, is cash flow. They're suffering severe cash flow issue. Unfortunately, that essentially falls in the federal domain. That's part of the monetary policy and state level. Punjab government has approved a program which is called Rozgar Punjab. It's essentially with a 9.5 billion rupee investment over 3 years. We aim to provide credit guarantee and cover risk for SME sector as well as young entrepreneurs. The framework that has been formalized is now known as RISE Punjab, which RISE stands for Responsive Investment for Social Protection and Economic Stimulus. So the RISE Punjab framework is based on 7 pillars, and these pillars essentially are economic recovery and stability, social protection, governance, health capacities and infrastructure, public financial management, education, and risk communication. So there was an issue of supply and demand, but now it's being produced or manufactured locally as well. So I don't think there is any issue of any health professional or law enforcement agencies. They're in abundant supply with the provincial authority, and they are now available in the market as well, generally as well. So now I think we are in a comfortable position. We in general, Pakistan in general has been fortunate that we've been able to bend the peak for some time and we've been able to build the capacity. Even now, although fingers crossed, the cases are number of cases is rising, but even now we have adequate capacity at the moment. There is excess capacity in every city. In Lahore as well, for example, the Georgetown facility, Expo facility is largely vacant. It's unutilized. So the health infrastructure is not under stress at the moment, and it can still handle a few more cases. I hope they don't increase, but we have capacity.